In recent years, the world of weight loss has turned upside down. Ozempic and its analogs have become bestsellers in pharmacies, with people buying them in huge quantities, and it seems like the whole world is losing weight. Yet bariatric surgery, weight loss surgery, still remains the most popular option. Why is that? Does Ozempic not work? Or maybe it's easier to go under the knife than to inject yourself with medication all the time. Let's sort this out today. I came to a clinic where they perform a huge number of bariatric surgeries every month. We'll talk to the specialists and find out the secret of bariatric surgery, why it's still so popular, and why it, not Ozempic, is considered the ultimate solution for weight loss.
Hi, my name is Dr. Talai. I specialize in bariatric surgery, surgical treatment of obesity. With over 7 years of experience, I have treated patients from all over the world: Europe, the Middle East, the CIS, and the USA. Most of them come with a very high body mass index, 40, 50, or sometimes even higher. This is not just about aesthetics. It's a matter of health and life. My mission is to help such patients return to an active, fulfilling life.
To be honest, being big it's not specifically belong to the one region like UK or like United States, but it is a huge problem. Most of my patients are coming from the New Zealand recently, United States, Switzerland, Germany, but mostly from UK, still UK. But the New Zealand, Australia, it's a good market, to be honest.
Now let's take a closer look at which bariatric surgeries bring patients from all over the world to Turkey. To explain this, we'll be joined by Professor Mustafa Uyar Kalaji.
Let me explain in simple terms the main types of bariatric surgery. Gastric sleeve, gastric bypass. The most popular procedure is the gastric sleeve. It is effective, safe, and suitable for most patients. Let's go into more detail. During this surgery, about 75 to 80% of the stomach is removed. The stomach becomes smaller and can hold only about 100 to 150 milliliters of food. That's why a person feels full much faster. Additionally, the part of the stomach responsible for producing the hormone ghrelin, the hormone that triggers hunger, is removed. As a result, after a gastric sleeve, patients experience much less desire to eat. Gastric bypass is especially effective for patients with type 2 diabetes, often leading to significant improvement and, in some cases, complete remission of the disease. The surgeon creates a small pouch from the upper part of the stomach. This becomes the new stomach. It's then connected directly to the small intestine. As a result, food goes straight into the lower parts of the intestine, which reduces calorie and sugar absorption and also makes the patient feel full faster. This surgery is also performed laparoscopically through small incisions. Already within the first week, patients begin to lose weight, and they typically reach their ideal weight within 1 to 1.5 years after the surgery.
I have too many patients. I will show you like before after photos. For example, Kirsty, she was from Northern Ireland. She was about to get married. I asked when was the decision that you want to go to the gastric sleeve. She said I went to the dressing shop for the wedding, but I couldn't fit. So this is a breaking point. And she said I want to do the gastric sleeve. I will lose weight. I will show you weight. And she got married, and now she had a child. Here is the patient. She lost a lot of...
Today, medications like Ozempic, Saxenda, and others are very advanced. Yet bariatric surgery remains popular. How is that possible? Does Ozempic not work, or the opposite?
Almost all of our patients, about 99%, have already tried medical treatments for obesity: Ozempic, Saxenda, Ozempic, and other medications. At the beginning, many of them did see results: reduced appetite, gradual weight loss. But after some time, the effect wears off. The body develops resistance, meaning it stops responding. Weight loss stalls or even reverses, and some patients begin to experience side effects. At this stage, patients often say, "I'm tired of pills. I want to solve this problem radically and permanently. I'm ready for surgery." And that is indeed a logical decision, because medications are only temporary support. They do not change the anatomy of the stomach. They do not affect the hormonal background, and they do not address the root causes of obesity.
During the first year after the surgery, the patient loses weight very actively, and within about a year to a year and a half after the operation, they usually reach their ideal weight.
If you have a tension problem, it will be solved. If you have diabetes problem, it will help. Type 2, it's no, but for type 1, it's no, but for type 2, yes, it does help. So, I mean, like, as soon as you lose weight, you feel more free to wear whatever you want, to be honest. As soon as you wake up from the surgery, your feeling of hungry is disappear. So you don't feel hungry at all. Okay, so this is about psychology. You will think that you're hungry, but actually you're not hungry. Okay, you have to focus on our dietitian list. And first we're gonna feed you with liquids, protein shakes, vitamins, pills, and other thing. And after 1 week later, we will start giving you, let's say, hard, like small puree, like this kind of mama, like small things. And after 2 months later, you will be full free to eat anything you wish. But the portions, I mean, like the size of your meal, it's gonna get smaller. Whenever you discharge from this hospital, we will give you a package for 6 months. We will give you full vitamins and the protein shake. For every patient, we are open a group, a WhatsApp group. So if they feel something wrong, they can immediately text. Even there is a time differences, we're always ready to answer.
If you're watching this video and feel that your turning point has come, time to change your life and seriously consider bariatric surgery, booking a consultation is very simple. Contact us on WhatsApp, Viber, or Telegram using the number provided. We'll ask you a few simple health questions and request some regular photos. No underwear pictures are needed. This information will be enough to pass on to the doctor. Based on your data, we'll recommend the most suitable type of surgery, provide the cost, and explain the preparation process in detail. We'll also help arrange your trip. Every year, millions of people around the world undergo bariatric surgery, and you can take this step too.
For example, even I don't feel good today, and doctor texts like, "Oh, can you please describe me more so I can help you?" Because this is
psychologist.
Yeah, it's not about psychology, but sometimes they feel nauseous after the surgery, which is normal, because eventually this is an operation. So we advise them, please stop eating hard foods. Or we ask them, did you eat any French fries, for example? And they say, oh, I eat a little bit. And they confess. And we say, please stop eating these kind of things.
So, how does the process work? On the day of arrival, a transfer picks you up, and you go directly to the clinic for examination. Diagnostics include blood tests, electrocardiogram, ultrasound of internal organs, gastroscopy. Every patient undergoes a full pre-operative checkup. After the surgery, you stay in the clinic for 2 days under 24-hour medical supervision. Then you are discharged to a hotel where you spend another 2 days. After that, you can safely fly back home. We also stay in touch with you for a full year after the surgery. Friends, today you've seen and heard everything for yourselves. Bariatric surgery specialists honestly explained how things really are. In my opinion, the key takeaway is that most people who come for surgery have already tried Ozempic and its analogs, but the effect was either temporary or didn't work at all. This once again proves there's no magic pill. Or rather, there is, but it doesn't look the way we imagine. It's bariatric surgery. Yes, it requires a short recovery period, but it remains the most effective and reliable way to fight excess weight and related health problems. Here in Turkey, we perform these surgeries regularly and at a very high level. And if you're considering bariatric surgery, getting a consultation is very simple. Just write to us on WhatsApp, Viber, or Telegram using the numbers on the screen. I wish you health and the weight at which you'll feel happy and confident. This was Tanya Velikorodnaya. See you in the next videos.